getting the maximum information that you were aiming and hoping to get. With that, we will go ahead with our session for today. We like as all the previous days have been, we can go ahead with the interactive session, and any sort of clarification you would all like to have also, we will do that through the session and after the session too. Now we have got an eminent faculty from Palliative, India. Warm welcome to Dr. Naicy Kushbu, who is an honorary dental consultant and volunteer at Palliative, India. She is a faculty for the on-site training programs in Palliative, India. She comes in at any time needed. She is in to help the teaching department to run the on-site programs. And she's part of Palliative India's home care team too. And she has 2 years of experience working with Palliative in palliative care. With that, I hand it over to you, Dr. Naicy, to take us through the session today.
Naicy ma'am, you can. Naicy ma'am, can you please unmute from your end? Dr. Naicy, please unmute from your end. Radha ma'am, you are muted. Are you trying to speak?
No, Sinia, I saw a hand raised. Okay. It was someone in called Swapna. I did. So, like if can you hear me now?
Yeah, can you hear me?
Yes, ma'am, please.
Okay.
We can hear you, Naicy.
Thank
you. Go ahead.
Thank you, Radha ma'am, for your introduction. I'm Dr. Naicy. Today, I'm going to deal with home-based care. So, as ma'am said, we shall have an understanding about home-based care. You all have might got an idea of it. Senior, can you please present the slide?
It's already there, ma'am.
Okay. Home care is for the bedbound patients. There are many who are unable to visit hospitals. Usually, healthcare professionals are available in the hospitals to take care of bedbound patients, and caregivers are there. And how about let's think about the home care. How about we give them a home care support? It will be a mental support for them, and we are actually helping them to get rid of their loneliness, to create a strength within them, and also get rid of fears, insecurities, and more confident in their life. Ultimately, we are giving them a sense of hope. This is our main aim or purpose to do this. Actually, we are giving them not only the physical support, but giving them a mental support. So before that, we have to understand who all need this home care? Whom all do we need these home care supports? So those who are having physical problems or mental emotional problems. So now physically unfit or unable, those who are physically unfit or unable to travel. So what does it mean? The patients who cannot walk or they cannot visit to the hospitals because of their physical distress or pain. So in such situations, we can give them, provide support by giving them home care. In some patients, no one to bring them. There won't be anyone to take them to care, or in such situations, we can definitely support them. Another situation is if a patient is having the financial strain. Suppose if the patient requires regular follow-up, or if they, for example, if a patient require any catheter change or anything like that, they require financial support to go to hospital. So we may not be able to give them any financially, we may not be help them, but we can help them physically and morally by giving them home care. So in another situation is, next slide, road conditions. As you saw you can see in this picture that the road conditions, it would be very difficult for them to travel, because it is very difficult for the patient to commute to hospitals for a regular follow-up. We can imagine how many shifts for a bedbound patients need for them to travel to hospital, from bed to wheelchair, then to the vehicle, then to hospitals. They need, how many shifts does it take for one care? So let's support them by giving proper home care. Next is walking distance. As you see here, it is very difficult to travel. So we have a home care team to support the patients in need of medical care. With what I would like to share is, with proper careful planning and implementation, home care service can help to improve the health and well-being of the needy. Next is what are the components of home-based care? By now we might have understood how palliative care works and how we support. Through your previous classes, or you might be knowing how this palliative care is working and how we are supporting the patients. Actually, it is palliative care is, as you all know, that palliative care is not for the patient, but to support the patient and the family. It is mainly focused on the total care, not the physical care, but the total care, emotional, social, spiritual care. So here we need to recognize the need of the patient and family, like here physical distress, emotional distress. As I said earlier, for financial support, we not need to financially support the patient, but we can try how good we can help them. Then next is spiritual distress. When a patient gets any terminal illness, he or she might think, why this happened to me? Why God did this to me? In such situations, we can give them support and elicit their problems. These are some of the, how many are there in this class?
Ma'am, around 30.
Okay. So now I'm going to, I would like to divide into 3 groups, 10 each. For the first group, shall we do, senior? Shall we divide into groups, or?
I think breakout rooms will not be possible.
No, Senior, no need to do breakup rooms or anything. What suggestion came to my mind is, in that participant, just take first 9 or first 10, just call their names. So they will all be group 1. That's enough. So you just tell the names of the first 29 are there today, no? Or 31 now, just 10. 1 to 10 in that order, whatever you've got in the participants. Because in some of the teaching sessions, we have done like that, and that's also easy. Just read out the names 1 to 10. That will be group 1. Will that be okay, Naicy?
Yeah, yes, ma'am. Actually, 3 scenarios are there, so I can divide them into 3 groups.
So first group will be 1 to 10, and you're okay with that. So let the 1 to 10 participate first. Is that right?
Yes.
Fine. So all of you will just go ahead in that form. So you just read the names of 1 to 10, and that 1 to 10 will go through this scenario and answer.
Okay. So the first scenario, shall I?
I will read out the names, ma'am.
Okay.
So in the first group, there will be 8 participants. Like we have only 25 joined. So Ansi A.
Senior, you can put the names in the chat also. You read and put the names in the chat, please, Senior.
Okay, ma'am, sure. It will be Ansi, Arati Pinto, Aravindan, Bharati Devi, Bharati Talisetti, Chakradar Sangavaram, Damodaran Tenkayala in the same group, in the first group.
Second group you can tell later. This
Okay, first
will
group,
let us do the first group with the names she has said.
Okay, for the first group, I'll read out the question. This is this case scenario of 40 years old man diagnosed with paraplegia. Patient is having Foley's catheter for incontinence of urine. Wife is having wife and 2 daughters. Wife is a homemaker, and the eldest daughter is 11 years old, and the younger daughter is 9 years old. This is the scenario. So for the first group, I would like to tell you that you can discuss in your group and what all things you can do with this in this situation, and how you will approach to the patient and family. What all things you would like to ask them.
Nancy, do you want to come out of this presentation so that we can see everyone, and that may be better off for discussion? I'm just asking. Do you want to just come out of the presentation so that we can see all of them and discuss, or what is your choice? Is this itself okay?
They can, these 10 of them can discuss, madam, and they can write it down. And after the 3 cases, one of them can present.
But see, because it is like an online session, no, they may not be, and we have also not been able to put them into rooms like in the Zoom. So they can type in their responses in the in the chat box.
Yeah, that's
all of you can type in, or we will give time. Anyone who wants to speak can also unmute and speak. Okay. Who wants to type, and the rest can unmute and speak also.
Ma'am, if needed, we can create breakout rooms, I think.
Okay, we'll see. Okay. You go ahead, Naicy. So you want to give all the three case
No,
scenarios,
ma'am.
right?
After first session, after first group, after discussion, we can go for the next.
Okay. In that case, we will just give 5 minutes.
Yes.
Okay. Like another 4-5 minutes, you all give your opinion for this.
Or else, ma'am, I'll go with the three. I'll read out the three scenarios, and or every one of them can discuss. No. After that,
Yes.
we'll discuss each.
Okay.
Right?
That's why. Go
Okay, the
ahead and tell
second
all
group.
three.
Okay. Second group. Here, 50 years old man is diagnosed with cancer, and his main complaint is pain. And the patient is taking pain medication, but he's not getting any adequate relief. And wife and 3 daughters, one got married, and the second daughter is studying in TTC, and younger daughter is studying in 9th standard. This is the case scenario, and patient is is taking medication, but after taking this medication, he is not getting any pain relief. So why we should explore why the patient is not getting adequate pain relief. So we need to communicate with the patient. So what all can you can ask with the patient and the family. This is the second scenario, and the third one is 73 years old female bedbound patient having 5 children, all are married. Elder daughter is the only caregiver and others are not supporting her. The husband is a daily laborer. How will you help this person? So this is the third one. You can type your response, or if you want, you can unmute and share. First, we'll discuss the group 1. Ma'am, after 5 minutes, we can discuss group 1, right?
Exactly. I think now let us come out of this presentation screen so that we can see all of them. And
Okay.
because when you are in this presentation mode, we can't see the rest.
Okay, ma'am.
So that might be helpful. See, this is an opportunity for all of you to, like, just as I said, no need that everyone has to be a professional. These are general issues. See, for example, the last one, 5 children, only one carer, patient is bedbound. If it was someone, your friend, neighbor, somewhere you see this type of patient, what are the things which will come? I just took that one as just a simple thing. Always when there are more issues, more options, more suggestions. So it's just there's no right, wrong in all these things. Okay. Like for example, you're just walking on a street and you feel someone falling down. One can walk continuously without seeing. One can go do everything. One can think, oh, if I go, I may be. So like that is what it is. It's a general opinion. So that is what we are looking at. Naicy, anything more you want to add on or something like that you have to add on?
Yeah, because while discussion we can add, ma'am.
Correct.
I think let's start with group 1.
Yes. Because there's nothing in the chat so far. So whoever is in group 1, you can unmute and speak. Just give your opinion.
Any suggestions, any opinion?
See, you need not give everything.
First, we need to talk to the family, understand their background, and build a trust so that they express more of their feelings. And then, since he's paraplegic, assess his physical accessibility, and then talk to the families about the government schemes that are available and the disability rights that are there, and talk to them about the rehabilitation that is available, and guide them to the free centers that who do the rehabilitation, and give more support to the caregivers, and see whether any livelihood opportunities can be arranged for the caregivers, and check whether any social organization available to provide educational support to the children also.
Thank you so much, madam. May I know your name?
This is Abhirami.
Okay, thank you, Abhirami. Thank you so much for your contribution. And what you have shared is really very, very much correct, and we'll discuss about it. So, anybody else?
There are
Can you
couple of
please share?
there are couple of messages in the chat. There are a couple of
I'm Dr.
messages in the
Bharti.
chat, naicy. You
Yes, ma'am. I'll check.
So a 40-year person with paralysis. Madam, am I audible?
Yes, ma'am. Yes, ma'am.
So physically, he can be supported with the physiotherapy.
Yes.
And about children education, he might be worried. And we can ask any charity or government to help for the children education. And wife can be asked about her education, whether she is suitable for any job or any homemade work also can be suggested, or any housekeeping, because we can support and say that God has given a challenge, but that can be overcome by making he also can have a earning like any coffee shop or any other making like umbrellas or any homemade and handmade things can be done, so that he also will be satisfied that he is doing something without much worry. Thank you, ma'am.
Okay, Bharati ma'am, thank you so much. Thank you so much for your relevant points. And we'll have a discussion. Anyone else? And we have Ardi Pinto. Then okay. Okay, let's start discussion. So for the first case, that is the 40 years old man diagnosed with paraplegia, and patient is having Foley's catheter for incontinence of urine, and wife and 2 daughters, and wife is a homemaker, and eldest daughter is 11 years old and the younger one is 9 years old. So in this scenario, for the physical distress, definitely the patient needs medications. The father is paraplegia, and he is a catheterized patient also. So what is the, you can ask many questions like what is the patient's condition, what are the needs of the patients, how is the family is coping up with the situations, and we can provide emotional support for the family. So in this situation, due to the physical distress, definitely the patient needs medication. And the another one is, next one is the patient is paraplegic too. So because he need so that he need physical rehabilitation, so we can provide him wheelchair support. And since he is paraplegic, there is a chance for him to get bed sores, so we can provide air bed also. And the mother is wife is a homemaker, so we can help her by giving any any other households like sewing machine or something like that, and provide we can help them by giving such sewing machines or any such financial helps we can provide, financial assistance we can give. And definitely very young children, so we can provide educational support also. Senior, can you please move slides? No, the next one. Next.
I'll leave it here, Sinya. I think this is what she wants, right, naicy?
Yes, ma'am. So as I told you, here what all we can do is we can provide medications and physical rehabilitation. Like as I told earlier, wheelchair, we can provide wheelchair and airbed. And the financial, we can explore the financial, psychosocial, the condition of the patient and the patient and the family. And we can provide food kit for them. And we can provide educational support for the children and vocational rehabilitation, like we can provide sewing machine for wife to earn. So here we are providing them not only physical support, but we are providing them emotional support, financial assistance, and also the practical help. Next we can move on to group 2. So group 2, are you ready for discussion?
So let's come out of the screen, Sinya, and have the discussion and then come back to this. See, like for all of you, see, this is what all of you were wanting, okay? That's why, like, just couple of minutes, naicy, because this is what they were asking. So this is just a brainstorming, okay? Just come out with whatever, like the first team, all of you come up with ideas which can be helpful from your point of view. What comes in your heart, please speak, because only then you will know right, wrong, or what to change, what not to change. We learn by our mistakes only. So nothing wrong. Don't feel bad or anything like that. This is a platform. No one is judging you here. Okay? So, and nowhere, generally in life also, you start to live for yourself. Then you will do only good. Okay, thank you, nicely. The second group, already Sinya has put the list of people in each group. So group 2, anyone, see, we are all not children, okay? So I'm not going to be calling any of you. From group 2, whoever is there, you just start and speak. How come Reena is not in any group?
Maybe missed out the name, ma'am. She can be part of the group 2, I think.
Which one you want to be?
Reena is in
2?
third group, ma'am.
Third group,
yes,
okay.
Reena is in the third group.
Okay,
Selva Kumari, ma'am,
okay.
you can join the second group.
Okay, basically, I want all of you to speak because all of you have queries. This is a platform where you all can speak. So come up with whatever comes to your mind, ideas, suggestions, either type or talk or whatever is your comfort level. Okay, go ahead, nicely.
Okay, so we can discuss the group 2 scenario. So here, after giving medication also, what I told you is after giving medication, also the patient is not getting adequate pain relief. So we need to explore that first. Why the patient is not having adequate pain relief after giving the medications. So while talking, so we should have a better rapport with the patient. We should communicate with the patient, and while talking, they started. We came to know that the patient is diagnosed with cancer. No, so her first daughter got married. So he took loan from the bank for the first daughter's marriage. So after 2 months only, he diagnosed. After 2 months, he diagnosed of cancer. So after that, he couldn't. Um, uh,
Naicy, you've muted yourself. So you have to restart again because we couldn't hear you. Sinia, can you hear her?
No, ma'am. Dr. Naicy. She's unmute from your end. Ma'am, please speak up. Is there any issues with your device?
This marriage, whatever you're telling, that's where it stopped.
from the diagnosis, right? Okay, I'll start from there. Okay, sorry for the interruption. Group 2, 50 years old man diagnosed with cancer. So in this scenario, we need to communicate with the patient why his pain is not controlled after giving the proper medication. So there should be some emotional distress also. We should explore that too. So when we came, after communication, we came to know that the patient first daughter got married. For that, he took some bank loan, and after 2 months of the marriage only, he came to know that he is diagnosed with cancer. So after that, he couldn't pay back the money. And moreover, his second daughter is studying TTC. For that also, he is not able to pay the um, fees. And the third daughter is studying 9th standard, and her school is going to reopen, and for that he couldn't buy books or clothes for her. So this is the main concern of the patient, and that's why his pain is not getting controlled after giving proper medication. So as I told you, that palliative care is not only for the physical distress, but for emotional, social, and spiritual well-being of the patient. So here, proper assessment should be taken, and for the pain, we can give proper medication and community involvement. Here, we need the community involvement is very much necessary. That is, we in this situation, to provide community intervention is very much necessary, that so that we can here we can solve the problem. We can receive the help of psychosocial problems. We can help them by resolving the bank issues. The bank issues we can resolve by the intervention of the community. We can talk to the bank and we can resolve their problems, and we can give educational support for the children also. Then what the patient said after resolving all these problems, what the patient said was, I don't mind if I die also, because that much relief I am getting now. So what does it mean? Physical distress is always associated with emotional pain. So once the emotional pain is resolved, the patient physical distress also get resolved. That's what this scenario tells us. The medication, after proper assessment, we are giving medication, and they are also received help with the psychosocial problems, and the bank issue was resolved with the intervention of the community. So here, senior, that slide, can you please?
Yes, ma'am.
Yes, we'll go back to the slide, please.
Okay. Is this slide?
Yes.
Yeah.
So
Thank you.
here, after proper assessment, first we have to do proper assessment. Then for pain, we can give medication, and we can resolve the problem by community involvement, and we can provide food kit for them, and for the children, we can provide educational support. And here the mother is not educated, and she is a homemaker. So like the first scenario, we can give vocational rehabilitation also. Then we can move on to the third.
So let us come out of the screen, please. And I was also thinking, Naicy, like, anybody else wants to add on anything for group 1 and group 2 discussion, anything that comes up, or anybody wants to say, even other group people, if you have anything different from what has been told, you can come up. We have had the discussion. Do you have anything more than what has been told? If so, you can.
Ma'am, I
not,
have only questions. That being a volunteer, we have to mobilize the resources for all those things, right? That is the most difficult thing. If we have all
Yes.
this wheelchair, bed, food kit, sewing machines, all those things, available, then it's not a problem. But how do, as a volunteer, we make it available?
That is where the challenge is. From day one, what I'm telling you, need not have thing. You have to find the link, being the bridge between. See, that is where that's why it is a combined effort. One, it's not that is why when you said also you want to start, what did I say? Not that we are not dissuading people, but we want everyone to understand all components are there. So that is why it cannot be like all what you're saying. Palliative is Dr. Rajagopalan's 25 years of hard work, and the team that he has. So what did I say in communication? That whole thing, team working. You like or not, you have to be a team. United we stand, divided we fall. I am a second standard teacher. Okay, all of us learned this, but we have very conveniently forgotten. And today's world, one man, nuclear family, there's no union at all. That's one of the trouble. Many times, no truth, faith, facts, when it is said, no one accepts it. But that's the truth. Why Kerala is sustaining, there is some reason behind it. Still, communities do so much here. I'm not telling it's not possible. You all have to work together. So as you said, all what she said, again, Palliative is not doing everything on its own. And Palliative is it's a small group funding organization. It is not having crores. Like the work that it does is so much, but getting funds from everywhere. So linking people. So that's what I do understand, Mr. Prakash Matthew. It is not easy, but you have to get some team working, identify like-minded people. At the same time, I don't want you to be disappointed also. That's why I'm telling again, find like-minded people. Start something very small and go slow, and then you will succeed. So
How do we handle these people, suffering people, when we don't get resources? Whatever.
No, that's what. See, little by little, one day you cannot bring the whole world down. Like, see, day one itself, you want to change the house. So that's what. Slowly only you can get. See, many times there may be issues. There may be funds within the family, but there may be some tug of war or wrong relationship going on. So finding out what is like that, so many things are there. So again, I would tell all of you, know, at least few days, if possible, you have to come and see what happens. What you have to see to believe. So even 2 days, 3 days, whoever is really interested in doing something, come over to, like, you can get in touch with the Palliative team and come as an observer and see how it is done. Because all of you think, oh, it's not at all, but it is being possible. Otherwise, how are we doing all this? Okay. So that is what it is. Little by little only it happens. Hard work and effort is needed. And then you have to find the right, many times they say, when you go for a meeting or something, you will pick up some spark. That's what both Dr. Rajagopal and all of them say. In a group of 10, 20 people, there may be one person who is like-minded and who will show up clearly that that person will work towards this. Pick that with them. Okay. So anything else somebody wants to add on? Otherwise, we'll go to group 3, nicely.
Okay.
Group 3 people can come up with your suggestions. Is there anything in the chat, Nancy?
Yeah.
From group 3?
Once services are provided, there are so many light people to support for it.
One services are provided. What do they mean? Maybe right people, not light people.
He wrote like that. Like-minded
right
people.
Like-minded people to support.
People support.
Okay.
Okay.
Anybody else wants to add on anything? I'm expecting something from you, Reena, because you are. So whatever comes, and see, you can even say what you did not get, because that will be an eye opener for maybe either you say now or after, because someone who has gone through will be the person. Sorry, because you came up only, I'm asking. Otherwise, I have got no right to ask you. Okay. Okay, because even you say that you did not get this, but if I had got it, I would have been better off. It is something simple.
Madam, I've been lucky enough to have found very compassionate doctors who had worked as a team for my husband. And I am offering...
Where from are you?
I'm from Mumbai.
Okay. Okay, then go ahead, Nancy. Then lastly, we'll come to her.
Yes.
Group 3, whatever they want to.
Assessment is the community involvement, psychological support.
Can we go to this presentation, or after that we'll go to presentation? What do you want?
I have presentation my phone now.
Okay. Yes, she will
Group
speak, and
3,
then when she asks me.
Yeah, here the mother is feeling isolated. So we should do we should think about how to help her. So if there are volunteers like you, we can provide appropriate help. Like how here what are the actions of volunteers here? You can visit the mother regularly to check in on or provide companionship, because she feels so loneliness. You can listen to her, offer her emotional support, and you can connect with her you can connect her with other resources in the community, like such support groups and all. So here in this case, the mother, the elder daughter is the only caregiver, and all others, actually she's having 5 children, but only the elder one is supporting her. So she feels so loneliness, and in such situations we need to provide some emotional support and compassionate to the patient. So these are the things, and we'll have an overall discussion about the 3 scenarios. Okay, ma'am, let's have an overall discussion about these 3 scenarios.
You want the presentation back on, or we can discuss and go to that?
No, ma'am, let's discuss.
And discuss.
So,
okay, now see, it's open. Everyone, now all 3 scenarios, anyone wants to chip in and say can add on. And I will just read what is there in the chat box also, naicy.
Okay, ma'am.
For group 3, somebody has put that assessment is needed. As the elder daughter alone is giving care, we can appreciate and provide financial assistance as her husband is a daily labor. We can also provide vocational rehabilitation for the family.
Yes.
See, only daughter, for that daughter, something you can do. And for the daughter, we can give some respite care. See, one person doing, if you're a carer, do 7, you will get tired. So we have to see what is the reason why the rest of the whole family not helping. So is there any way sorting it or something like that, if it's possible?
Yes, every day the daughter, she is looking after her mother. So once in a while we can go and help her for help in households and everything we can help. So we'll have an overall discussion about these 3 scenarios. In group 1, as I told you, the patient is paraplegic. So definitely he needs physical rehabilitation because the patient is bedridden. So we should help with an air bed because we have to look out for the pressure source. So for that we can provide them air bed. And it is not to, the airbed is not to cure the bed. So it will not cure the bed sores, but to some extent we can prevent the bed sores. So gradually, and another thing is we have in palliative care settings, it's a teamwork effort, right? So we have physiotherapists are there. So with the help of physiotherapist, we'll put them in a wheelchair. And after that, after exploring, we came to know that they have financial issues also. So in such situation, we can provide food kit for them, and we have provided educational support for the children. And since the wife had no skills, we gave her sewing machine. Our intention is here in this case, our main intention is that this should be a source of income for them so that their life can go on. And so here what all things we have provided them airbed, and we have provided them wheelchair that helps the patient to move around. So and we have provided them food to help the family to meet their basic needs. And we have also provided educational support for the children. And in group 2, we have given medication after proper assessment, and they also received help from the community. How? Because the bank issue was resolved with the intervention of the community. And in case 3, the mother felt so much isolated, so we helped her because volunteers can visit them and provide companionship, and we can listen to her, and we can give emotional support to the patient. Now, basically, we should understand that what kind of help you can provide, right? What all kind of help we can provide?
Physical,
Yeah.
like taking to the doctor, visiting them, giving them emotional support.
Yeah.
Listening to them, being there, or helping them out with some day-to-day activities.
Yes. Thank you so much. Yes, we can provide physical care. Definitely, we can provide physical care. Within that, you can provide medication after proper assessment. But the physical care means not only reducing the physical pain, but also we can give physical aid also. That is, For patients, you can provide a walker for people who cannot walk. That physical aid can help the people to maintain their independence. That will give confidence for the patient, and through that we can improve the quality of life of the patient. Another thing is, next is emotional care.
Dr.
Slide.
Naicy, I would like to add one more thing.
Thank you.
Especially in Tamil Nadu, I don't know about the Kerala and other states. There are some schemes available in the government for the disabled cancer patients and for the elderly people who doesn't have care in the home. So those schemes, if we are able to educate them and help them to avail those schemes, that will be like a sustainable long-term support, financial support for them. So especially in Tamil Nadu, for disabled, they get around 3,000 per month, and they also get the physical aids like scooty or Neobolt wheelchairs and things that enables them to move around and find a livelihood option. For the cancer patients, also for the transport, it's train and bus transport. It's made free of cost, and I think they get monthly 1,000 to 2,000. So if there is some such schemes, we can educate them for a sustainability, for their sustainability.
Thank you so much, Abhirami. Here comes a major role of volunteers. In such situations, in all these things, you can help them to educate them about these schemes of government schemes and all, and you can help through this way. And next is slides. Senior emotional care. Yes, thank you. When a person is bedridden, there are many physical and emotional problems. What are the emotional problems usually the patient face? Loneliness. These are some of the emotional problems for a bedridden patient. It is loneliness, depression, anxiety, guilt, suicidal thoughts, feeling of being a burden, loss of meaning in life. Patients sometimes, especially for bedridden patients, they feel like he or she is a burden to everyone because they are bedridden. Patient feel anxious and depressed, and he or she wants to be someone to listen. So, next, social care. Social care is like for such patients, there is no job, so no money, no food, loss of home, loss of land, no education for children, unable to get the children married, or no status in the society, stigma. These are the social issues these patients usually face. And the spiritual care is like why God did this to me. My mother is very nice person, she takes good care of us. Why did this happen to her? I don't have anyone else to share anything. All these are the issues these patients are facing. So next is organizing home care services. So now we understand that we need to provide a lot of support. So now we need to figure out how to do all these things. So to organize home care services, what do we need to what all things we need? That is, first one is vehicle. So we need a home care conveyance. So we need a vehicle for transportation. Next one is home care. Next is trained volunteers. So we also need trained volunteers like you. People who are not trained don't know what palliative care is. That's why we need to give a proper training for volunteers. That's why we are giving proper training for volunteers. If people who are not aware of palliative care, they won't be able to properly, they won't be able to communicate with the patients proper. So that's why we need to give proper training. Communication with the between the patient and the volunteer is very much important. The main thing is, while communicating, we should not give any false hope or premature reassurance to the patient. So here the proper training is very much essential for volunteers to be able to provide effective home care and services. So volunteers need to be able to, for communication means, for that volunteers need to be able to build a rapport with the patient and with their family also. So they need to provide emotional support as well as the physical care. Next is trained health professionals. It is not enough to be a doctor or nurse. They should also be trained. They should know the what palliative care is, which is palliative care is a specialized field which requires deep understanding of physical, emotional, and spiritual need of the patient. They should also know that it is not enough that they are a doctor or a nurse. They should know they should have a thorough knowledge about palliative care. Next is team meeting and discussion. Here, regular team meeting and discussions are very much necessary. We need to discuss what we can do next. How have we missed anything? Is there anything we can contribute? Anything we can contribute? So for that, a proper discussion between the team is necessary. Only then you can the team becomes stronger. Team members need to be able to communicate effectively to ensure the team members need to communicate effectively to ensure that the patient receive proper care which they need. And next one is regular follow-up. Regular follow-up is also necessary. How are the patients? Are they taking the medications properly? Do they need a doctor? What are their needs? This can be communicated with the patients, and if it is anything necessary, you can communicate with healthcare professionals. So and another thing for organizing a home care service is medicine kit, home care kits. You can see the picture. This is the medicine bag. Can you see? This is the medicine bag, and it contains a medicine kit and procedure kit. So if the patient need any medicines or procedure while home visit, you can do them. You can do for them any procedures like catheter change or any procedures. You can help them. And next is types of home care. Types of home care are doctor-led home care, nurse-led home care, social workers-led home care, and volunteers-led home care. So volunteers can also do home care. How? We can be a good listener to them and do not give any false hope. We should not give any premature, as I told you earlier, we should not give, you can be a very good listener, but should not give any false hope or premature reassurance. Just tell them, if you don't know anything, you can tell them that you don't know regarding that, and you can provide emotional support to the patient and families. That is, the volunteers should also be very much prepared to acknowledge their limitations, and they can refer the patients to qualified professionals while exploring. If anything necessary, you can refer the patients to qualified professionals when it is qualified professionals, or you can connect with the palliative care. Next is Emotional support, that is communicating with the patients. As I told you many times that we need to communicate with the patients, we need to give emotional support. That is what we can do. We can give emotional support to the patient. And another thing is exploration of the problems, because while communicating, they share their problems, and sometimes they cry. We can patiently listen to them and comfort them, but at the same time, you can always listen to them, you can comfort them, you can give a comfort zone for them, but make sure that it is important to listen the patients without any judgment, and to offer you can offer them comfort and understanding, but you should not patients you should listen the patient without any judgment. Next is next slide. General hygiene. General hygiene for bedridden patient. So so here it is important, the general hygiene and skincare is very much important. So how to do, we should educate the patient how to do personal hygiene, what to do about their pressure sores, help them to take a bed bath, because caregivers are doing it every day, so they'll be tired, so at least once a day we can go and help them. So, and we should assess that if they are giving the bed bath in a right way, we need to help them. If they wanted, we can help them. For in bedbound patients, if a bedbound patient is getting proper attention, and if a bedbound person does not get attention, his skin will get cracked. So we need to tell them how to care about it, turn the patient every 2 hours, moisturize him, and we can provide air bed or water bed support. It will, as I told you earlier, it will not cure the bed sore, but it will, we can prevent it from it for some extent. We can, and next is oral hygiene. And definitely oral hygiene is very much important. We often we often neglect it. Usually patients, we neglect oral hygiene, but it is it's a major part. It's oral hygiene is, if the oral hygiene is not proper, many problems will arise. 80% of the systemic diseases are linked with oral hygiene. So it is, oral hygiene is equally important to overall health. So that is, if poor oral hygiene may lead to variety of problems like infections, bad breath, tooth decay. So clean the mouth regularly. So what are the cleaning instructions we can give for normal patient? We can give the self-care educations. We can give, what are the self-care educations? Brush the teeth twice a day with soft toothbrush, and toothpaste left in the mouth can cause dryness. That we should educate them. You should not keep the we should not brush for a long time, or we should not keep the paste for a long time. That will cause dryness of mouth. Then rinse the mouth with warm saline water or sodium bicarb solution. And tongue should not be cleaned with tongue cleaners. We should use only soft bristled brushes for cleaning tongue. We should not use tongue clean. Do not encourage using tongue cleaners. And ask them to take plenty of water. And danger should be removed during night and keep in a bowl of water. These are some of the self-care educations we can give. And for terminally ill patients, we can give some instructions, like including some home. We can give educate them for using homemade saline solutions. Homemade saline solution is water or 0.5% of sodium chloride preparing saline solution, 500 ml of water. In that, we can add 1 teaspoon of common salt and boil and cool and keep in a covered container. So for terminally ill patients, we can use a spoon with cotton wrapped around it, and with the saline solution, we can clean the oral cavity. And preparation of sodium bicarbonate solution is 500 ml of boiled water and 1/4 teaspoon of sodium bicarb. So this can be used for terminally ill patients, and where it is you should not. It is the oral hygiene is very much important, and poor oral hygiene make it difficult for patient to eat or drink, which lead to weight loss and malnutrition. So provide them proper instruction how to clean the mouth of for the terminally ill patient by following these instructions, and keep the patient comfortable to prevent further complications, and always make sure that wrap the spoon with clean cotton, and clean the oral cavity with saline water. Never put your hand inside the mouth. Next is catheter care. Catheter care is change the catheter and strict antiseptic. Next slide, strict aseptic practices, perineal care, oral fluid, and bowel care. If such a tube is inserted in the bladder, there is a chance of infection. So tell the patient, tell them to clean it properly, and pay attention to the bowel movement. If any constipation or the urine will not pass, and that may lead to infection. There is a chance of infection. There is a chance of infection in this way. And proper water intake is necessary. If not, the patient will get infection. So pay attention for giving proper water intake. And constipation also, bowel care is constipation can lead to problems for the patient, terminally ill patient. So it is important to promote regular bowel movements. Provide specific instructions how to promote bowel movement, including increased fluid intake for the patient. Then next is one more thing is perineal care. Clean with soap and perineal area with wash the area with proper soap and water. Next is ensuring compliances. You can ensure the you can ensure that the patient are taking medications correctly by asking them to demonstrate how they take their medication. If the patient is unable to demonstrate how to take the medication, you can offer help. And you can also ensure that patients are taking medication on time by setting timers or alarms. If the patient is unable to set timers, you can the caregivers can do it for them. Or if the patient is staying alone, you can seek help of neighbors also. So, and in some usually we say take medication properly for every time everything we say, but sometimes the patient because of the in some poor patients, there won't be any clock in that home. So in such situations, we can help them by providing any clock or something like that, or else we can ask the neighbors or any children in nearby. You can ask them to help the patient by giving medicine at a regular interval. So next is benefits of home care. Home care can provide a number of benefits for the patients and their families. Patient and family feel support, patient receives that is increased it increase the comfort and support. Patients can receive the care they need and in their own homes and surrounded by their loved ones. The next one is they will get individual attention. In hospital settings, at a time, the doctors might see so many patients, but in home care settings, they'll get individual attentions. So, and then the patient remains part of the family. Full assessment of the patient and family. That is also an important thing. Here, during home visits, full assessment of patient and family also. They'll provide full assessment of family, patient, and as well as the patient and family. It is important to conduct a full assessment of their need. The assessment includes medical assessment and emotional assessment, not both medical and emotional assessment. That is, medical assessment means the should focus on patients' current medical condition, their medication, treatment, any other potential complications are there. Then emotional assessment means should focus on patients' emotional well-being, including their coping up mechanism. Any concerns, patient is having any concerns. And by after discussion we can decide how to manage them and we can discuss with caregivers and help them to reduce their stress and anxiety of the patient and family, and prepare patient and family for any anticipated difficulties and symptoms. Next is teamwork. Together, everyone achieves more. By working together, we can provide patient with the best possible care. By providing patient with emotional support, physical care, and attention. Here, you can help to improve the patient's quality of life by giving all these supports. And definitely palliative care providers, they give care and help to coordinate care and provide support to the patient and also to their families. And definitely social workers can also help the patients and address their social and emotional needs. They can also help the patients with the community resources also. And actually it is, I told you, it's a teamwork effort. Here volunteers, social workers, not only doctors and nurses, volunteers, social workers, nurses, doctors, physiotherapists, but what they need is proper training. And physiotherapists can also help the patient to maintain their mobility and function. To cure sometimes, to relieve often, to comfort always. That is, listen to the patient's stories and concerns. Patients often appreciate the opportunity to talk about their experience and feelings. Then you can provide activities that patients can enjoy. They're like reading, watching movie, or simply spending time together. Help patient to maintain their independence. This could include helping them to dress, bath, to prepare meals, so on. And by taking the time to provide comfort and support, you can make a real difference in patient's life. So and also it is not how much we give, but how much love we put into giving. That is, what they need is sometimes what all they need is active listening also. They have so many things to share. So at least we need a emotional support for them by listening their problems. I think that's all about home-based care.
Thank you, naicy. You have in fact given so many examples because this was what was the query everyone was asking, and so clearly and with examples you have explained. Thank you very much. Can we come out of this screen, please? So now see, like all of you had these type of queries only in your mind. So has this clarified? Before that, there was one thing in the chat box for which I replied, naicy, basically asking why tongue cleaners cannot be used, and I had mentioned that the tissues are very friable. So the whole mouth cavity, everything, when they are very elderly, they may have some infection. If it is malignancy, that is, if sorry for using the wrong word, if it is cancer, all tissues are so vulnerable and friable. That is why even brushing, we, as naicy explained, sometimes we even say not be able to open the mouth, or due to the medications they are taking. Many medicines have side effects of gum, causing gum bleeding. So that is why we recommend that these type of, see, there are, we can talk for 1 hour just on home-based things that we teach. Okay, everything cannot be said in this 1.5 hours. That's why naicy had took a nice thing of the brush. So like that bristles of the brush normally we take off and do. The other option, what she said, was spoon, because you need a handle, and you can use gauze and hold one end in your hand and roll the spoon, where the spoon side is there, roll it with the gauze and use that to clean. Just with saline. See, all this you can make at home. You need not go buy. Maybe saline 100-150 rupees. Water is available at home. Salt is also available. Soda bicarb, all of you do idli dosa. So you will have. So water, salt and soda bicarb. You can make these solutions at home. So this is one example we gave. We teach them to make dressings at home using your pressure cooker, that is autoclave. So many things are taught.
Sorry for their information. I would like to share one thing.
Go ahead.
Actually, this tongue cleaner is not recommended not only for the patients but for everyone. We are not, as a dentist, I would like to tell you, tongue cleaners are not at all recommended. Because so many, our tongue is full of papillae. They are very much sensitive. So if you use tongue cleaners, all get damaged. So it is better to use soft bristle brushes to clean your tongue.
See, you've got expert. She's a dentist also. I was also, my next sentence was that you're getting from the horse's mouth. It's not someone telling don't use tongue cleaner. She herself is a dentist.
So I think that's fair.
So that's all. So these are the things which are helpful. So, okay, coming to like what is that as volunteers? Now, what you were asking, has it clarified what all volunteers can do? There is one more question I see. What are the responsibilities of a social worker which a volunteer cannot perform in a home-based palliative care?
Yes, that I have already mentioned here. That is, social workers plays a very major role because they are, I think I have already told you, for addressing the patient's social and emotional need. They can also help to connect people with the community resources. And they are assessing, the social workers are assessing their psychosocial problems. It is
their training. See, they have studied MSW courses are there for 2 or 3 years. They have done bachelor's, master's in that in their respective field. So assessment and things is done better off by them. That is one of the aspects. The main thing is that they are trained to pick up, and then all these chart and things what was shown yesterday, it's all like second nature for them. But anyone who is interested has to learn and then do the options. So that is the answer I can give, because it's by experience. Next, if you want to do, you have to work on it and then do. Any other query or anybody wants to ask?
Dr. Naicy, very well presented. You have covered so many and very intense things, very well, clearly explained. And in our personal experience, I would like to share that just touching the patient, sitting beside them, and talking eye to eye, or just holding their hands gives so much warmth and comfort to them, and they get emotionally connected with us. So that's one big thing we have noticed in our experience.
Human, being humane, that humanness,
Yes.
that goes a long, long way. You cannot value it or put any cost to it.
Exactly.
That is beyond anything. What Abhirami mentioned, am I right, isn't it? Abhirami is your name. See, that is what is lacking. See, the group 3, what did you get? A mother who has 5, 6 children. Her own children are not even coming and seeing her. If Abhirami goes and sees, Abhirami becomes her 7th child. She becomes the first child because her own 5 children are not seeing. Abhirami becomes the first child. And that too, Abhirami is looking after her when she is maybe even leaving the world. So Abhirami will be remembered more than the rest of her own biological children. That goes a long way.
Yes. Out of my personal experience that I mentioned, I had a wonderful team looking after my husband. They took care of him as well as me during his illness. And that goes a long, long way. I still remember them. They're still in touch with me.
That is what has brought you into this session today. If you had a bad experience, you won't be doing this. See, even I would say in that also, even if someone has a bad experience, they may think what happened to me should not happen to anybody else. It can go that way also. That is also good. Or even if I suffer, I will not anybody else suffer.
Right.
It can come like that also.
That
is also a good act.
I wanted to learn, join this course and understand how exactly I can be of help to others. I had a good experience, but then I want to extend that to others who are in need.
See, from Abhirami's thing, that all the schemes which are available. One more thing, what I wanted to add on was first making the public aware of it and also helping them how to get it. Many times what happens, many schemes are there, but they don't know how to access, what form to fill, how to fill, where to give, what is the best way of giving the form and getting it. For example, I also know something in Tamil Nadu, but I have traveled, having started working with Palliative, I've traveled to all the three, 4 states in southern, like Andhra Pradesh has Arogya Shri scheme, and Tamil Nadu has Chief Minister scheme. This Arogya Shri Chief Minister scheme, they're all somewhat the same. So like that, each state has some scheme. So you have to pick up that scheme. Most of them have a limit of 1 lakh, 5 lakh per person. All this, it's there. So even for in Chennai, I remember one person who needed esophageal cancer. Up to surgery, it was done because the first part of surgery costed some 60,000-70,000. Was done in a government setup. So that was covered. So he had the surgery, radiation, and then something like that. So if it is just chemotherapy also, all these schemes covered. So you have to tell them what is available, and those help you can do. You can fill up form or guide them where to go. See, you need not give money. You need not spend even 1 paisa. but one more thing I'll tell you, your time is valued to multiple multiplication of money. Okay, so you valuing another person time of devoting. These are the many things which are there. And if anybody else, this
Ma'am, your voice is breaking, ma'am.
I think your voice is breaking, ma'am.
she would like to ask.
Ma'am, please unmute yourself, Radha ma'am.
Can you hear me now?
Yes, ma'am.
Hello? Can you hear me now? Prakash always wanted to ask something. As we have got a couple of minutes, I thought if you can ask Prakash, whatever I can answer, I will try to answer. Is Prakash still there? I can't see him now.
Yes,
Yes, he's there, Prakash Matthew.
I'm there, ma'am.
So after attending for these 4 days, have some of your queries been answered, or still you have queries? Please do ask if you still have something.
Yes, ma'am. I'm worried about that. So much, volunteers. Whether how much Pallium India is, solving. How much people's problems Pallium India is able to solve, and how much more is there. I just want to know about the statistics of
What Pallium has. See, this.
Yes.
No. Yes. That's what you can go on to the website. Pallium India website has got every. Senior Sangeet is there no today. Is that right?
Yes, ma'am.
Sangeet, if you could share them our Pallium India website, so much of information is there. And naicy's last slide, I was telling every time what team you basically need. naicy's second last slide had, okay, volunteer, social worker. For that, Sangeet.
Teamwork.
I think she had team working. That team working slide. They will all get the slides, Sangeet, don't worry. So that slide had, Prakash, which has what is that you need. Okay? That is why I have been telling you need all the components of that. Without that, it won't work. So, and again, I'll tell you, 100% of solving everything may not be possible. Because for all of us, sky is the limit. But we will be satisfied with something better than nothing. So we try to do as much as we can, and everyone can at least put an effort and try and do. You may not be able to solve everything. This is what, thank you, Sangeet. So see, you have social workers, volunteers, nurse, doctor, physiotherapist. To start off itself, you may not have everything, but at least base, one doctor, one nurse, and one social worker is the minimum. Then as you develop, get more fun, we can come out of this, Sangeet. Thank you. If you start off slow and build up the team, then you will get to where you are.
Understood. And one more question, ma'am.
Yes, Aravindan has shared all the link and things. Thank you, Aravindan. So this one, please see the website, and then he has mentioned the book also. Yes, all of you, is is a really worthwhile read, that book,
Oh,
to
wonderful.
see what all is there and what is done, what can be done, how it is done. And from how Dr. Rajagopalan started to where we are, everything is there in the book, because we were all with him for the book release also.
Okay.
Okay, go ahead, Prakash, and then maybe we'll be getting to nearing the finishing time.
What is the main current latest problem that Pallium India is facing in Pallium care, specifically in the home-based care?
We have like, see, they have been doing home care for umpteen years. Every day, 7 home care teams goes. So here what they have is 23 years of hard work. So as I'm telling, 7 home care teams go every day. This is a demo unit for the whole of India.
No, ma'am, my question was like the current pain point, like is it a shortage of volunteers or shortage of doctors, or you have a lot of people, but the patients are not there. What is the real problem that you are
No. We have plenty of patients. Each area has 200 patients.
Okay.
So this is, as I said, no, this is a setup where everything is available. They have so much of social network, community. There are some centers where the community is willing to help the organization run the clinic and things there. So this is a model unit for all to see and set up a practice.
Okay, so if there is no shortage, that means Pallium India is serving all the population in its region, or is there still people waiting to but not yet served?
Pallium is there in Trivandrum. That is the area being served.
Okay, so all the patients in Trivandrum area is served, or still more people are there waiting for a service?
See, some 2,000 to 4,000 patients are seen every year.
Okay.
Minimum, all these type of patients. That's the statistics. As Aravindan has mentioned, you go into the website. Okay. All your queries will be answered in the website, because the website has got all the information.
Understood. Actually, yeah, see that of course any organization will have some pain points. That's what I was trying to understand, and what all kinds.
You have to see what you have to. As I said, this is a demo unit. This is different to what is being done here. Is something with so much hard work they've got to where they are, because of their time tested and the type of care and efficient care they've been providing. So it's worth coming and seeing if you really want to see. You have to get in touch with Pallium and then organize your observing 1 or 2 days or something like that and see. Yes, have a look at the website first. Yeah. First have a look at the website and then see. Okay, if I couldn't see any other queries in the chat. Okay, in that case, I'll hand it over to you, Sangeet.
Thank you, Dr. Naicy, for the wonderful presentation with the examples. Thank you, Radha ma'am, for the facilitations, and thank you all for participating and sharing your experience with us. Thank you. Let's see you in the next class.
Thank you, one and all.